Yes, I did. So I packed it up and brought it back to the crib. Just a little something, show you how we live. Everybody want it, but it ain't that serious.
Their efforts changed the world, helping millions of African Americans diagnosed with asthma and allergies get the proper treatment and care.
Around the country, when we started, there were only 5 black allergists. Asthma in the African American community posed a devastating problem. If you look at an African American child, 3 times more likely to die from asthma than other children.
We're losing people every day. 10 people die from asthma every day.
There's an increased prevalence of asthma in the African American community.
Back in 1984, 3 leading doctors saw the future and founded the Allergy and Immunology section of the National Medical Association, later to be renamed the Allergy, Asthma, and Immunology section.
We actually met at Floyd's house in the fall of '84 to plan for the initial section meeting in Montreal in '84. So that was really something that was exciting to be part of, just coming out of fellowship, having an opportunity to interact with the 3 of them.
These 3 gentlemen, it was fundamental for them to put their stamp to give us a higher profile.
I would give credit to Floyd Melville, Larry Robinson, and Michael LeNoir. We were basically people who followed on after them. And they allowed the establishment of the Allergy Immunology section, later changed to the Allergy, Asthma, and Immunology section.
We were able to educate the other sections that asthma was an important thing, and the old joke was the difference between an allergy and a cold was $250. But we tried to educate people more about treating asthma, the strategies that were available at that time.
The founding members have been extraordinarily important.
But we felt that in order for it to get the proper place within the context of what African American physicians considered high health priorities, we need a separate section. Dr. Melville was the chief of allergy at Howard University, became the dean at Howard University, and had come from Johns Hopkins, extremely well known in the research world. He had a tremendous reputation to bring to the organization, so that we could use his largesse to put together the group.
Dr. Floyd Melville has been highly influential with regards to guiding younger allergists and telling us some of the pitfalls that exist within the specialty as we try to build our careers.
We sit on really broad shoulders. Dr. LeNoir, Dr. Robinson, Dr. Melville.
And when I think about the legacy of the section, I think about the legacy of the individuals who started the section.
They have taken the time during their lives to help all of us who are here now and more and very active in the section, but even beyond the allergy section. They've just served as mentors to many people.
We have a long way to go because we don't have nearly the number of allergists to train in the United States for the need, and we certainly don't have the number of Afro-American allergists that's required for the need.
Now, 30 plus years later, the group is stronger than ever.
It's 30 years now, we probably have well over 150 to 200 African American allergists.
33 years, I don't think anyone could have predicted that we are where we are from their perspective. I think they would be proud of the number of persons that have actually chosen to go into the field.
The section has been extremely responsible for increasing the focus of this organization on asthma in urban inner cities and among African Americans and African American children.
We've been able to increase the awareness about asthma and allergic disorders within the NMA and outside the NMA. The NMA serving as a venue for media outlets to learn about what's going on in various disease specialties and addressing the disparities, which we're all aware of, which, by the way, haven't improved very much. The disparities still exist after all those years.
Those 3 guys, they are Swiss Army knives. They do everything. They come from a tradition of what I call scholar activists, because they were professionals, but they still had their hands, minds, and hearts in the community. And that's my model for myself. So they mean a lot to me. When I envision them, when they lay down at night, they're as long as the Nile River. When they stand up in the morning, they're as tall as Kilimanjaro. And they're not replaceable. We can just only try to be like them.